Welcome back to Afternoon Express. Now, approximately 1.5 million people are diagnosed with schizophrenia every year. With this in mind, it has become imperative that we raise more awareness to the fact that it is a treatable condition and that there is hope for those that have been diagnosed with the condition. Now, we have Dr. Lebogang in studio to shed some light on the diagnosis, causes and treatment of schizophrenia. And if you've got any questions for Dr. Lebogang, just hop onto our social media platforms and don't forget to use the hashtag Afternoon Express in all of your comments. Welcome to The Loft, Doctor.
Thank you for having me.
So, Doctor, there's so many myths and misconceptions when it comes to schizophrenia. So please just break it down from the beginning. What is schizophrenia, and what are some of these myths that challenge us daily?
So schizophrenia, falls under the group of, psychiatric or mental health disorders called psychotic disorders. And you're right that, there's been lots of misconceptions or, misinformation about the illness. There are many, but commonly, for example, people would say, many patients who are diagnosed, or many people who are diagnosed with schizophrenia are violent. Actually, very few of them, would, embark on, violent activities. When they do, it's often when they're ill. Many of these patients, I believe that, we must lock them up in psychiatric hospital. They should not be integrated in society. When they are on treatment and in a supportive environment, many of them are able to fulfill many of their obligations, either academically, socially. Also, many of them are able to hold jobs. Some of the misconceptions is that, are related to the causes, that, the mother caused it, or that, it was because of poor parenting. Wow. And as far as we know, there is no one single cause of the illness schizophrenia. It's a multiple of factors, possibly starting, during pregnancy, life events, and when the disease would express itself, late in adolescence or beginning of adult stage. And, some of those misconceptions, again, would, include the fact that, people with schizophrenia cannot hold jobs. In fact, when you're diagnosed with schizophrenia, often many of these patients are victimized. Yeah. They are asked to leave their jobs. People with schizophrenia said that they cannot have bear children. You're going to pass it to your children. So those are some of the things that we hear, and many of them are not true, because we do know that there's a considerable amount of people who are living with schizophrenia who have given birth to people who are normal and have no sign of illness whatsoever.
Absolutely. So for our viewers at home who are not well educated on schizophrenia, how does it manifest itself? What are some of the first early traits that you can see in a loved one to be able to diagnose it? Is it more of a clinical diagnosis?
Definitely, it's I think it's important that people understand that it's a clinical diagnosis. So by that we mean that there's no blood test or X-ray or some investigation of some kind that you can say, like we do with certain forms of medical illness. So it takes diagnosis of through interviewing many people, the family, the patients. In some instances you may need to go into the work environment, the school, if it occurs early, to find out what the symptoms are. So biologically we know that the changes in the brain occur from when the person is growing. Yes. But the disease would express itself in late adolescence, so in the 17, 18 years old, up between the age of 25. So often it would be loss of interest in, activities, so there'll be deterioration in functioning. People may begin to experience, what we'd call hallucinations. So you'd hear voices of people talking and are not there. And to these people, these voices are real. So if, you get a command hallucinations or, some instruction to your mind telling you, go do this and this, for those people, it's real. They would have odd beliefs. So they would, they can believe that, become suspicious of people.
Wow.
Sometimes they could paranoia, persecutor, or believe that other people would want to harm them in any way. And sometimes they believe good things, which often may even get them into trouble. That I'm related to Barack Obama. Yes. I have hearing voices that I need to board this plane to get to America. And I'm going to address this big gathering. So that's some of those illnesses that would be there. So those would be some what we'd call positive symptoms. So negative symptoms would be that what often people would see what we'd call psychiatrists and clinicians would call affective blunting. So lack of expression, there'll be difficulty with how they label certain things or express their language, and so on, yes.
It seems like this, a lot of people seem to call it split personalities, but that is far from the truth. I mean, this is more of a separation from reality.
The core feature of schizophrenia is impaired reality testing, which is different from a group of disorders such as personality disorders. Yes. So in schizophrenia, it's impaired reality testing. So what we're saying is that when somebody tells you something which may not be true or real, to them it appears that it's real. And that is, you know, one of the main features of schizophrenia. And when I speak to people is that, you know, schizophrenia, it's a disease of good people. So it's not, you know, bad people who just choose to get these symptoms in that way.
Doctor, whilst we have you here, we've been asking on social media if you've got any questions for Dr. Lebogang, and we've got Bafana Dlamini here with a question for you. It says, hello, doctor. Kindly please tell us the symptoms and how one can tell if a person is schizophrenic. So you've already said a shift in interest, specifically between the ages of adolescence from 15 years up.
Yes, so that is more or less when the disease would express itself. So there will be what we call positive symptoms and negative symptoms in terms of how clinicians would group those. So it would be hallucinations, so abnormal perceptions. So people would hear mainly voices, you know, visual hallucinations, not a core feature of schizophrenia, but rarely could occur. So when people would see things that others do not see, but mainly it's auditory hallucination in third-person commentary, running commentary. So it would be somebody commenting on what you're doing.
Yes.
It would be disorganized behavior. So you'd see a previously highly functioning person now being disorganized, not looking after themselves, you know, collecting garbage. There'll be, you know, disorganized speech and odd beliefs, so that are not in keeping with reality. So those that would call delusions, and would have negative symptoms, as I said, you know, affective blunting and difficulty in expressing, you know, the commonly learned language.
Absolutely. This seems so diverse and like such a complex disease and mental health treatments. So we've got you throughout the show, and we want to continue engaging with you. We've got one more comment here from a viewer, Urai Sibe, who says, it's one of those mental illnesses or disorders characterized by disconnection between thoughts and feelings, including actions, which I think is right on the mark.
Definitely. So I think there is no illness of mankind like schizophrenia that affects the essence of what we are as human. If you think about it, it affects, you know, what we think, what we believe, what we remember, how we relate to other people, you know, what we perceive of ourselves.
Absolutely.
So there is no illness of mankind, you know, that affects the essence of who we are as we are as human.
Well,
like
Doctor, you can hold it right there because we do have you until the end of the show. Thank you so much. Keep those questions coming in on our social media platforms. So stay right there because after the break, we continue this very, very incredible conversation with Dr. Lebogang. See you after the break.